Hi, welcome back to Med Rounds. This is Dr. Tim Moser. Today's discussion is atrial fibrillation. Atrial fibrillation is probably the most common arrhythmia in people, especially after the age of 65. In many cases, it's completely harmless, but in other cases, it can cause serious side effects, such as heart damage or stroke. Now, to understand what atrial fibrillation is, we have to first discuss the normal conduction of the heart. Now, the heart is a muscle that pumps blood, but a muscle just like any other muscle of your body. In order to contract, it needs to have an electrical impulse generated from a nerve. As this electrical impulse gets conducted through the heart muscle contracts. And when the heart muscle contracts, blood is pumped to the lungs and out to your body. In the heart, this electrical impulse is generated in the right atrium. Now, the right atrium is located at the top of the heart, and as the name implies, it's on the right side. Incidentally, you also have a left atrium. So the electrical impulse starts in the right atrium, and in a very orderly fashion, it is conducted through the heart muscle. Once the heart muscle finishes its contraction, there is a slight pause before the next electrical signal is generated by the right atrium. Now, in atrial fibrillation, instead of this nice, orderly electrical signal being released, several areas of the right atrium are firing all at once. And this can raise the heart rate from a normal resting rate of 70 in a healthy individual all the way up to 200 electrical impulses being generated all at once. So the heart is a very patient and polite organ that tries to keep up with all the electrical impulses it's presented with. So the heart muscle is trying to contract at a very fast heart rate. But if you're generating over 200 electrical impulses in the upper portion of the heart, there's no way that the heart can contract that fast. The result is some of these impulses get conducted, some of them don't. And so the heart becomes very irregular. Patients describe this as feeling palpitations or having a skipped heartbeat now and again. In many cases, even during atrial fibrillation, the heart is pumping an adequate amount of blood to keep the person alive. Oftentimes, in atrial fibrillation, the person remains symptom-free. During atrial fibrillation, blood may actually pool in the upper regions of the heart and not get moved through in an effective manner. Now, if blood is not moving, if it's more stationary, then it has a greater tendency to form clots. If a clot forms in the upper portion of your heart, it may later break loose. After a blood clot breaks loose from the upper portion of the heart, it can be pumped out of the heart, out into the body. Since a large proportion of the blood that the heart is moving or pumping goes to the brain, this blood clot can be pushed up into the brain where it plugs up a blood vessel and causes a stroke. To help prevent the complications of atrial fibrillation, patients are often placed on blood thinners. Now, the most common blood thinner used is Coumadin, also known by the generic name warfarin. Warfarin's a tricky drug. There's no specific dose for a patient's weight or age, and so the dose is constantly being adjusted. Regular blood monitoring is needed to make sure that the blood is not too thin. If a patient takes Coumadin, it often interacts with other medications, especially antibiotics, requiring the dose to be adjusted. Complications of using blood thinners include making your blood too thin, in which case you can have internal bleeding or you can bleed in your brain, especially if you fall and hit your head. Now, sometimes atrial fibrillation is treated with medications to slow the heart rate down. This is especially true if your heart rate is over 110 beats per minute. In comparison, a normal healthy heart usually beats around 70 to 80 beats per minute when you're at rest. Medications used to slow your heart could include drugs such as beta blockers, calcium channel blockers, or digoxin, otherwise known as digitalis. There are some medications that can actually help bring your heart out of atrial fibrillation and back into a normal sinus rhythm. Drugs in this class would include drugs such as amiodarone, which has to be monitored very carefully, and you also have to watch your thyroid because it can affect your thyroid function. Some patients in special circumstances will have a more aggressive approach taken by their healthcare team in order to help with the atrial fibrillation. One of these is electric cardioversion. And in this case, the heart is actually shocked in an attempt to make it come out of atrial fibrillation and start beating normally again. Now, patients that are candidates for this are often heavily sedated because you wouldn't want to be awake when your heart is shocked. It's a procedure that oftentimes can bring the heart back in to a normal rhythm and help prevent people from having to take medication. The most aggressive approach used for atrial fibrillation is also one of the newest, and is called radiofrequency ablation. And with this procedure, a catheter is placed in your groin artery. The catheter is fed up to your heart, and the area of your right atrium is mapped out. What they're doing in the mapping procedure is looking for areas in the right atrium that are the source of these abnormal signals that are causing you to be in atrial fibrillation. If these areas can be identified, then they're destroyed using radio waves. Now keep in mind, only a very, very tiny portion of your heart muscle is being destroyed using this radio wave ablation. The benefits of using radio frequency ablation for atrial fibrillation are that you are now back into a normal sinus rhythm, you're not going to need blood thinners, and you won't need any medication to slow your heart down. In essence, your heart has returned and is back beating normally the way it should. This has been Dr. Tim Moser with MedRounds. Until we meet again, wishing you the best in health and prosperity. Take care.